Hip fractures can be devastating in terms of cost, quality of life, and social resources. Is the current standard of care adequate? If so, why is hip fracture still such a problem? What are we doing well, and what could be done better? To explore this question, we will discuss evidence-based assessment and treatment with researchers, orthopedic surgeons, and physical and occupational therapists at all levels of care. Dr. Lewis's interview of Dr. Eagle demonstrates the kind of cutting-edge content that you'll find in this course. The following excerpt embodies the credible, straightforward style of the course instructors.
Weight-bearing considerations, do they differ based on site, age, and device?
Actually, that's a very good question. Following fracture fixation for hip fracture, all patients are made weight-bearing as tolerated. Studies have demonstrated that patients self-regulate their own weight-bearing status. And if we make them non-weight-bearing, it makes it very difficult to mobilize them post-op. So if everybody's made weight-bearing as tolerated, the patient will regulate their own weight-bearing status. And this has been shown to be very, very safe and efficacious.
Now, I do love that you're saying that. However, all over the country, people don't do that. I mean, a lot of orthopedic surgeons have people non-weight bearing. What would be the reason to do that?
They don't understand biomechanics.
Could patients actually injure themselves if they are non-weight bearing?
Well, it's not that they can injure themselves if they're non-weight bearing. They're not going to injure themselves. But it's going to be difficult to mobilize them and get them placed into the appropriate rehabilitation programs if they're made non-weight bearing. It's very difficult to mobilize these patients, and studies have shown that patients getting up and onto a bedpan while lying in bed put as much force across the hip as when they're weight bearing. So we have a saying, if you're going to let your patient take a poop, you might as well let them walk.
Come join us in updating your knowledge and skills in working with patients who have hip fractures.